I am staying for the whole day because I will learn as much from you today as I hope I can share just a little bit for you. I've had the privilege of working with Ronald McDonald House Charities for almost 20 years now. It's really hard for me to believe that it's been that long. But just a little bit about my own personal background. So I have a background in public health. I grew up in South Carolina. My uncle, Rick Horton, there on the right, was diagnosed with HIV like in the 80s and died in 1990 when I was a college senior. And so I was studying economics. I went to UNC Chapel Hill. I got my first job at the Research Triangle Institute doing economics work, but started volunteering as and I'm giving you a little more background than I normally do, frankly, but just when I saw the agenda for today, I worked as a case management volunteer with these AIDS patients. He was an AIDS patient in North Carolina, where everybody was still very afraid. There was one van who went all around the state of North Carolina collecting these largely young men to bring them back for treatment, and no one really knew what to do. So they were all on an ICU unit. I was bringing things for their families, and my first patient was my age, and he died within a couple of days. So I knew that I wasn't made for one-on-one, work. It was so painful. But I learned about public health, and that's when I was like, that's what I want to do. I want to make an impact at scale. And I know this is the right calling. So I've worked in academic medical centers. I started at Henry Ford Health System in Detroit. And then I worked at Methodist Healthcare System in Houston, Texas. And so had a lot of experience working on the hospital side, which makes me really excited talking to a group like you today. But then my husband is also a hospital administrator, and eventually I switched over to being in the healthcare nonprofit sector and worked for the Susan G. Komen Breast Cancer Foundation in New York City. And then I found Ronald McDonald House Charities, where I led the Southern California chapter for 5.5 years, and started this little project that eventually turned into the last 12 years of doing impact research with RMHC Global. So next slide, please. So I like to start with this because, we live in a time where we have these large global companies. There are not that many truly global nonprofits. And I like to say, so next year is the 50th anniversary of Ronald McDonald House Charities. They did not have a plan when they started in 1974 that said by the year 2023, we want to be in 65 countries and we want to have, 400 Ronald McDonald houses. It just didn't work that way. So this is a very different organic sort of growth. When you hit a chord that resonates everywhere around the world, that is such a unique mission. And I think that's why we've been able to get such talented leaders like Carrie and Tony and the rest of the team here. And it's definitely what's kept me working with this organization for as long as I've been there. So they never had a plan that said we'd like to be in Uruguay and Ukraine and Rome and Salt Lake City. I mean, it just never was on their mind. So next slide, please. And when I came to Ronald McDonald House Charities, there weren't a lot of people who had like hospital, public health kind of backgrounds. You had a really wide range of powerful experiences, but I think my skill set was a little unique. And so even to this day, like when I came to my chapter, our mission was to provide a home away from home for families with seriously ill children. And I think that is a very powerful mission. But what we've learned after doing a lot of the research I'm going to talk about today is that our mission is so much more than that. I think that was really understating what we're really doing for these families and for their children and for the hospitals that we partner with and the communities. So really, like, I was just a part of a process at Global about 5 years ago where we changed our mission statement to say a world where all children have access to medical care and their families are supported and actively involved in their child's care. And I'm not here to suggest that one is more important than the other. I actually think they're both extremely important parts of what we do. But I think that in our own mindsets, we've gone from being sort of a sweet, nice addition that we provide to families and hospitals to being truly an essential part of the healthcare system. And I hope that our research will show that to you. So next slide. So when I started this little journey when I was in Southern California, I sort of thought about it as I wanted to explore with my Southern California chapter, what is the role that Ronald McDonald House program plays and the healthcare experience for critically ill children and their families around patient and family involvement, around the patient experience and satisfaction. I think I understood how important that was to our hospital partners because I had been in the hospital world. And then in terms of clinical outcomes, do we have an impact on clinical outcomes? And so next slide. So that was sort of the genesis. And so today I'm going to talk about some of that. We'll go to the next slide. So what that led to is I learned about this whole concept of family-centered care. And so these are sort of principles of family-centered care that, frankly, I don't need to tell you, you know this. My talks are often to such wide ranges of people that it's more helpful when I include it. But when we started our research journey, we ended up becoming partners with the Institute for Patient and Family-Centered Care. And these principles around people being treated with dignity and respect, healthcare providers communicate and share complete and unbiased information so that families feel like they really have information regarding their child's situation and the decisions that need to be made, that patient and families are encouraged to participate and care in ways that culturally some families are more comfortable than others might be, and recognizing that, and then understanding that collaboration with patients and families can really not just improve an individual child's healthcare, but also policies and systems and sort of operations at bigger scale. So next slide. And then we've had a whole interesting conversation about, well, what is a family? And I think what happened is that we were seeing that these families take different shapes and forms when you're working with a program that's serving families. But now we tend to define it as a group of individuals with a continuing legal, genetic, and or emotional relationship that should be determined by the patient or the people that represent the patient. So next slide, please. And so research. So kind of what this journey has been on that I've been learning is that there's a lot of research that existed. When we started this role of Ronald McDonald House Charities formally playing a role in research, there were 0 published studies. But what we learned is that separation during hospitalization is traumatic for children and families. I think we got to revisit that all again during COVID. A lot of this work was done before COVID was even a thing, obviously. And there can be long-term adverse outcomes. Hospital safety, quality, and healthcare value are improved when families are involved and present, and that families need physical, educational, and psychological support to be able to be involved in their child's hospital care. And what's really interesting, because I don't have a clinical background, is that, human brain development, this is especially important for pediatric patients. It's important for all patients. I just lost a 100-year-old grandmother. There's no way that journey would have been the same if the whole family hadn't have been involved. But because there's so much development happening in a pediatric patient, whether it's sensory development, brain development, all of these things can, 24/7, the best hospital care in the world cannot attend to all of the ways that pediatric patients are developing. So next slide, please. So we can skip this. So when we started this journey, we were talking about ourselves as providing lodging. I kept thinking to myself, well, hotels really provide lodging. I can see that there's so much more happening. And so we came up with this understanding through doing our original literature review that Ronald McDonald House Charities was really helping to enable access to care. We're enabling family-centered care by supporting access. A lot of these families, as you well know, the people who stay at the Ronald McDonald House here are coming from more than 30 miles away. they would not have access to the best medical care for their child if they had to depend on their local community hospital. So by having a place to stay that can be provided at no cost or low cost, we are enabling access for these families. We're reducing the financial burden for these families significantly. We're helping to provide psychosocial support by giving them sort of a liminal space, a space outside of the hospital to do some of their own recovery when they're not at the bedside. We're allowing the whole family to be together, which isn't always possible at the bedside. That was even more problematic during COVID, I know. But we've also learned through our research that we're significantly enhancing the hospital experience, and we're helping families retain some amount of normalcy, and they're better prepared when they return home. So next slide, please. I'll skip this and go to the next slide. So I want to talk about the specific studies. This one is really the original study that we did in Southern California. We did guest exit surveys. We had 5 Ronald McDonald House programs when I was there, and we were able to collect 2,000 responses. What we learned is that families who were able to stay together believed more strongly that their ability to stay nearby, so proximity matters. I tell this to every Ronald McDonald House program. Proximity really matters. It's amazing that you have 4 family rooms and a house. I think that's just a huge bonus and the work that we're doing together, but it helped their child's recovery. These families really believe that their ability to stay nearby helped their child's recovery, and it helped the Ronald McDonald House helped their family stay together. And when we say stay together, I think what's so powerful is for us, like, what does it mean to stay close? What does it mean to stay together? You know, it has so many meanings, and I think that that's part of what we're helping the hospital provide. We found that this was even more strongly so for Hispanic families. We obviously served a lot of Hispanic families in Southern California. Next slide, please. So the other study, which again, I love talking to a hospital group, is that I was able to connect because of my hospital experience with the head of NRC Picker. So Press Ganey, I think you guys use Press Ganey here, but Press Ganey and Picker are the 2 major hospital experience studies that are used, not just in the US, but also in Canada and in Australia, interestingly. So we added 3 questions. Where did you stay? How much did your proximity help you stay involved with your child's care? And how did it improve your experience? So next slide, we had 10 hospitals participate. 6 were children's hospitals. The others were pediatric units within a general hospital. We also had 5 with a Ronald McDonald House program, charities program, and 5 that did not. So for us, the beauty in that is we were able to compare places that had a Ronald McDonald House Charities presence and not. Okay, next slide. Okay, so this is like where it gets to the geeky sort of research part. So I will say that this was one of the most exciting things that I've been a part of. We asked people what their overall experience was, which is what the hospitals tend to rely on. What was your overall experience for your hospital stay? And what we saw is that the families who stayed in a Ronald McDonald House, so we were expecting the experience to be better than if they had stayed in the child's room. It's just not very restful. You know, there's a lot of interruptions. We expected the findings to be stronger. So their experience was 2 times better if they stayed in a Ronald McDonald House than staying in the child's room. But what amazed us is that, this little circle should be up on RMH ones. I don't know how that happened. But what really impressed us, we were struck so highly, is that staying in a Ronald McDonald House, their experience was even better than if they had stayed at their own home. And we talk about ourselves as providing a home away from home. That's really what we see our purpose as. But in fact, their experience in the hospital was better than if they had stayed in their own home. And so that was when we felt like, okay, we're on to something really important here. We need to understand more. Next slide. How helpful was your accommodation and supporting your family involvement in your child's care? These findings were even more significant. So from 3 to almost 5 times higher. And so that's when we understood being able to participate in their child's care and having a positive hospital experience were really essential in that process for these families. Next slide, please. The next study we did was truly a global study of hospital administrators worldwide, wanting to understand. These were all places that had a Ronald McDonald House Charities program. So we asked them, what do you think the benefits are of having a Ronald McDonald House Charities program? So again, with this one, we expected that the vast majority would feel like we helped them in providing lodging for their families. But we were amazed to see that even more of them believe, 95% of hospital administrators worldwide believe that having a Ronald McDonald House Charities partnership enhanced their ability to provide family-centered care. Next slide, please. Okay, so now on sleep. Last night I got 100% sleep quality. I was like, go Marriott, go being away from home, no husband, no dog, no child. It's terrible. These days we're measuring our sleep. We have so many monitors that can measure our sleep. But we did this study in 2014, which was kind of before people were really monitoring their sleep in the way we are now. And we used these sleep measures. This was done in the UK, and compared the sleep quality for families who stayed at the Ronald McDonald House versus those who stayed at the bedside. And no surprise, the families who stayed in a Ronald McDonald House had much better sleep quality. And I think what's really important, just thinking about the rest of the conversation today, many more hospitals worldwide are starting to put a place to sleep at the bedside. And for Ronald McDonald House Charities, this is positive. Sometimes I'm with my colleagues and they're like, oh, well, they still need us if there's a bed at the bedside. And my answer is always absolutely 100%. Because one parent can stay at the bedside. And it's one thing to stay at the bedside every night for 7 days. But it's another thing when your child is going to be there for a long stay. And the best thing for the parent is to be able to be rested and to be more present when they're actually there. And so this study helped us understand that it's a win all the way around. We want there to be an opportunity to stay close by. I will say that the way the family rooms were born is that being able to stay across the hall from the ICU when you have a very seriously ill child is so much easier than leaving to go a little bit further away. Like the closer you are, the better it is. And it really depends on how long your child is hospitalized. So next slide. And then there was the pandemic. And I don't know how it is here a little bit with my conversations with Carrie and Tony. Some of the research we've used in places around the world, like I've had the privilege of going to Ukraine, and I was just in Chile. They don't have any space for families anywhere. Like the families are literally in the stairwell of the hallway. So in some places, it's helping the whole healthcare system reimagine. It's kind of where the U.S. was, decades ago. But here, it's almost a matter of we have to relearn. Even in my own personal life, it's like I don't quite do the same things I did before COVID as readily. But in a hospital setting, all of our hospital staff have been through such a difficult few years. And COVID took such a toll on caregivers at all levels. And one of the things that we've heard is that it became more apparent, like there were so many tasks that families do, helping the child go to the bathroom, helping to feed a child. When you have more restrictions on visitation, which is not really the way we like to think about families. We don't like to think about families as visitors. We think about them as being essential. But it is true that COVID has set us all back a little bit. And so just relearning, how do we want to imagine this? There were actually some things during COVID that were very good. Like we learned how to do, video consultations. There are some things to this that probably merit staying, but there are also some practices that we just need to reimagine. Okay, what do we want family-centered care to look like as we try to move into a post-COVID world? I don't know that it'll ever fully go away, but it is a call to action. It does give us a call to action to think about this. And this is what I think is also beautiful about the timing of your workshop and your conference today, is that, this is something that we can do better together. So next slide. We can skip this, the next slide. The last thing that I'll touch on is that so when we started this journey, I said there were no published papers. Ronald McDonald House Charities had really never been a part of formal research. And I think that what's come out of this is we published 11 academic papers as we did the research that I shared with you. It's a longer journey. It doesn't happen overnight, as those of you who are involved with research know. But for us, it was sort of a game changer, and the kinds of conversations that we're able to have with our hospital partners and with our own organization about what our role is in family-centered care, because we started 50 years ago. And I was at a meeting early on where some of the healthcare leaders were saying, you were the originators of family-centered care. We started this program before family-centered care was really sort of an adopted concept. And I think that we've been so careful to say that we enable family-centered care. We do not have a role in any direct caregiving whatsoever, but we'd like to see ourselves as essential partners in the healthcare process. And the other thing that came true during COVID is that even still, I think a lot of our Ronald McDonald House Charities teams globally didn't quite see ourselves so strongly as part of the healthcare ecosystem. But during COVID, a lot of our Ronald McDonald House Charity staff were counted as essential medical workers by the hospital teams and were able to get their COVID vaccinations early, as hospital workers and healthcare workers were. And I think it changed everyone's mindset, because we understood that what we were doing for these families, the families whose children needed medical care during COVID, those children were very, very sick, because anybody who had any optionality about whether they could postpone the treatment for their child would have. And so I think that it helped us understand that we really do have an essential role, and that the research has really been valuable to us, but also very valuable to do in partnership with our healthcare partners. And so we recently, within the past year, Ronald McDonald House Charities has established an official research center at UCSF. I worked on this research with Linda Frank, who is our new lead investigator at UCSF. And so we have a new series of studies that we're undertaking. Next slide, please. So the year one research aims of our research center are really looking at social determinants of health and how they affect families during and after the hospital stay. There's so much of an priority these days on health equity, advancing health equity, understanding underserved communities. And again, just as Ronald McDonald House Charities is playing a role in family-centered care, we know that we have helped underserved families predominantly be able to access world-class medical care. And so this rose to the top of what research questions we thought we should really seek to understand more. And then looking at current family-centered care knowledge, practices, attitudes among chapters, partner hospitals, and stakeholders. And in a way, we're sort of replicating that earlier hospital leadership study that we did globally. So that's where things are today. Next slide. So this is so sweet because this artwork, I know you've probably all gotten your own beautiful artwork from children, given the work that you do. But this is one from Southern California when I worked there. And this is where I'm like, the families have been telling us all along, right? Like, thank you for keeping our families together.